Welcome to this COVID-19 video series. My name is Leah Yamson-Yoke. I'm an infectious disease physician assistant at the University of Washington and the Fred Hutch Cancer Center in Seattle, Washington. Today we're going to be talking about antivirals that treat COVID-19. In the early days of the pandemic, many of us as providers were scrambling to find medications to treat our patients. And now, gratefully, we have several medications in our toolkit that we're able to use for our patients. Today we'll be talking about some of those medications. It's really important to understand that early initiation of antiviral therapy is critical. Why? Well, first, the body's immune system has not yet had a chance to ramp up. I'm talking specifically about the adaptive immune system. Second, many of these medications target viral replication, and viral replication has only just started early in infection. And third, antivirals were studied at the early point of infection, and that early initiation is key for treating our patients. Antivirals for COVID-19 include nirmatrelvir, ritonavir, molnupiravir, and remdesivir, which we'll talk about. The first drug that we'll talk about today is nirmatrelvir, ritonavir. It's an antiviral that's actually made up of two drugs. The first is nirmatrelvir, which actually blocks viral replication. The second drug, ritonavir, is a CYP3A inhibitor and increases the plasma concentration of nirmatrelvir. It was studied in the EPIC-HR trial, which showed an 86% reduced risk of hospitalization or death when compared to placebo, if given within 3 days of symptom onset. The FDA has approved nirmatrelvir ritonavir for mild to moderate COVID-19 infection in adults, and it's under emergency use authorization for children who are 12 and older, who are at risk for progression of severe COVID, and weigh at least 88 pounds. Nirmatrelvir ritonavir is given typically 3 tablets twice a day for 5 days. Common side effects include dysgeusia, or kind of a metallic taste in your mouth, and diarrhea. Nirmatrelvir ritonavir can be used outpatient, but it can also be used inpatient if a patient is admitted for a reason other than COVID-19 or develops mild to moderate COVID-19 during their hospital stay. Nirmatrelvir ritonavir does have a warning for drug-drug interactions given that it is a CYP3A inhibitor. Given this, it's important to monitor patients, particularly those who are on statins, calcium channel blockers, or anticoagulants. It's also important to review the entire medication and work closely with pharmacy while placing patients on nirmatrelvir ritonavir. The next antiviral we'll talk about is molnupiravir. It uses a different mechanism of action and causes lethal mutagenesis. It was studied in the MOVE-OUT trial, which showed a 31% reduced risk of hospitalization or death when compared to placebo. It is under emergency use authorization for adults only in the treatment of mild to moderate COVID-19. It is not approved for use in children. Molnupiravir has no known drug-drug interactions, but there is a theoretical risk of drug resistance, though there is limited data. There is a concern for use in pregnant people, given animal studies have shown some concern for fetal risk. Common side effects include diarrhea and nausea. Remdesivir is the final antiviral that we will talk about today. It is an IV medication and can be given both outpatient and inpatient. If given inpatient, it can be given 1 time daily for up to 10 days. If given outpatient, it's given 1 time daily for up to 3 days. It's really important to check liver enzymes prior to initiation, as it can cause elevations in transaminases. It can cause increases in prothrombin time, so also good to check your coagulation studies, and also can cause GI upset or hypersensitivity reactions. In the next video, we will talk about how to use these particular medications in your practice and share decision-making with the patients that you treat every day. Thank you.